Good afternoon. Thank you for joining today's webinar, When Nursing Homes Close, Learn the Federal Rules. I'm Alisha Lineswala, the Public Policy and Program Specialist at the National Consumer Voice for Quality Long-Term Care. This is the second in the series of webinars on nursing home closures that's part of a larger project that we have been working on at Consumer Voice. We've been looking at best practices and how to carry out closures in a way that preserves and protects the rights and interests of residents, maintains their dignity and choice, and also minimizes the impact of transfer trauma. Today's webinar will address the federal rules that govern nursing home closures. Our presenters today include Dr. Cynthia Rudder, who is the founder and former executive director of the Long-Term Care Community Coalition, a New York statewide advocacy organization for long-term care consumers. Dr. Rudder is now a consultant for several not-for-profit organizations. She has received a number of awards for her research and advocacy, is part of many state and federal advisory groups, and has published several articles on nursing homes and assisted living facilities. We'll also hear from Consumer Voice staff, including Lori Smetanka, who is the Executive Director of the Consumer Voice, and me. For today, all lines are on mute. You can ask questions by typing your questions in the question box in your control panel. We will get to as many as we can at the end of the presentation. Under your handout section, you will see today's PowerPoint, our issue brief on nursing home closures, as well as a copy of our report. The webinar is being recorded and the recording will be made available on our website. With that, I will hand it off to Dr. Rudder to provide a project overview and closure recommendations.
Thank you. Would you go to the first slide, please? Alisha, the first slide, please.
Is this the right one, Cindy?
I just have the agenda here.
It's showing the first slide on mine, Cynthia.
Now it is, yes, thank you. Sorry, okay, thank you. Welcome everybody to our second webinar. At our last webinar, as Alisha has mentioned, we talked about the study we did, some recommendations, and we mainly spent time on talking about how you can create a strategic plan to implement some of the recommendations from our report in your own states. One of the reasons we got very involved in nursing home closures is because it's quite clear that nursing home closures are becoming more frequent, both because consumers seem to want to get care in a community setting or in their own home, and because state and federal government policy have driven these changes. Many states and the federal government are trying to cut Medicaid, as many of you know, and they're pretty happy to try to close nursing homes, thinking that care in the community will cost a lot less. We're not sure that's true, but that's the idea. Next slide, please. I'm sorry, the slide is not coming. Maybe it's just very slow. Okay, thank you. The resident stress of moving is occurring nationwide. And what we're finding is that the idea of closure in nursing homes seems to be inadequately addressed in both state and federal laws and regulations. And we think that when closures are inevitable, and of course, many of us do not want nursing homes to close. If possible, they should be improved. Better policies and practices, we believe, can be implemented to minimize the negative effect. Things like transfer trauma, as Alisha has talked about. Next, please.
Are you seeing that it's moved on yours, Cynthia?
No, it has not yet.
Okay, we are seeing the next slide.
Okay, I will just go on. Just one moment, please. I will just go on. I'm just trying to pull up my slides from here. One moment, please. What's the topic of the next slide? If you can just tell me, please. I'm sorry.
Negative impacts of nursing home closure.
Okay, thank you. Yeah, just came up. It seems to be very slowly coming. As many of you know who work in the field, there are many negative impacts of nursing home closures. There's obviously transfer trauma, which is also referred to as relocation stress syndrome, where residents get sick, can die just because it's a new environment for them. At the last webinar, Tom Ledoux from Wisconsin talked eloquently about how his state deals with that issue. And that's, of course, in our report as well. There's things like self-care deficits that have problems, impaired ability to perform or complete activities of daily living for oneself, as feeding, bathing, toileting. Next, please. Alisha, if you could just send me my slides that you sent this morning, that would help as well, too. Oh, it's just come up faster now. Depression, increase in withdrawn behavior. Next, please. Falls, weight loss. We can just keep moving along, Alisha. One of the reasons we conducted the study done last year in 2016, released in November, is to find out what the experience were of closures, and then we decided to conduct a national study to find out. Next, please. I'm so sorry. If you can hold on 1 minute, I will try to get the slides. We seem to be having some technical problems. Alisha, have you moved that?
Hi, Cindy. Yeah, it's on the slide that's titled National Study Funded by the Retirement Research Foundation.
Yeah, it's not moving at all.
Okay, Cindy, I've just resent you the slides.
Thank you. I apologize, everybody, and I'll just pull them up, and as we go, I'll just talk through them once I know what's up there. Our national study that we did, again, one of the reasons we did this study, by the way, was because we had anecdotal evidence of some terrible closures that caused major problems for residents. So we decided to do a study on that, and we got some tremendous amount of funding from the retirement research. And what we wanted to do was to find out what were the obstacles to a successful closing for nursing home residents, identify policies and procedures for overcoming them, and then make recommendations. Please look at the full report. There are so many recommendations for the federal government, for state government, for ombudsmen, that I think you'll find them helpful. Next, please. The results of the study found that there were 6 major obstacles to a successful closing. Lack of appropriate and nearby placements. Didn't always mean that there weren't vacancies. Sometimes nursing home residents just didn't want to take people. Poor discharge planning. It may not be a surprise that a nursing home that was forced to close because of poor care had poor discharge planning at the time of closure. They probably always had poor discharge planning. A lack of communication between the facility and residents and families. Poor notice, not enough time. Staffing issues. Staff being upset that they were going to lose their job. Staff being sad, staff being bitter, staff being upset, and transfer trauma. Next, please. Again, take a look at our full report for all the recommendations. One of the major findings of our study, in addition to the obstacles, was that many local and some state ombudsmen did not know the federal or their state nursing home closure rules. And one of our recommendations for ombudsmen and for citizen advocacy groups was to make sure that they all understood what the federal rules were and for the rules of their own state. We found in a number of cases during the survey and interviews of local and state ombudsmen that when they were asked, do you know what the federal rules are, many said no. And given the fact that the participation of the ombudsman was so crucial in every successful closing, according to our report, it became crucial that ombudsmen really understand what the rules are. And that's why we're here today. And we're going to now spend some time on talking about both the federal rules for closure as well as the new federal rules for discharge, which is highly aligned. And I'd like to turn it over to Alisha, who will talk about some of the federal rules. Thank you.
Thank you, Cynthia. As Cindy mentioned, when a nursing home closes, the transfer discharge regulations apply. As many of you know, the revised federal regulations include new documentation and notice requirements when transferring or discharging a resident. Under the new requirements, when the facility transfers or discharges a resident, the facility must ensure that the transfer or discharge is documented in the resident's medical record and appropriate information is communicated to the receiving healthcare institution or provider. This documentation must include the reason for transfer, in this case a closure, and the documentation must be made by the resident's physician. In addition, the closing facility must provide the following information at a minimum to the receiving facility when transferring the resident under a closure. This is the contact information of the practitioner responsible for the care of the resident, resident representative information, including their contact information, advance directive information, all special instructions or precautions for ongoing care as appropriate, comprehensive care plan goals, and all other necessary information, including a copy of the resident's discharge summary and any other documentation to ensure a safe and effective transition of care. The revised federal regulations include new requirements on the actual notice of the transfer or discharge that residents are entitled to. Before transferring the resident, the facility must notify the resident and the resident representatives of the transfer or discharge and the reasons for the move in writing and in a language and manner they understand. The facility also must send a copy of this notice to a representative of the Office of the State Long-Term Care Ombudsman. The notice must also include the reasons for transfer or discharge, the effective date of transfer or discharge, the location to which the resident is being transferred or discharged to, a statement of the resident's appeal rights, including the name, mailing and email address, and telephone number of the entity which receives such request. They must also include information on how to obtain an appeal form, as well as assistance in completing the form and submitting the appeal hearing request. The facility is also now required to provide and document sufficient preparation and orientation for residents to ensure a safe and orderly discharge from the facility. This orientation, just like the notice, must be provided in a form and manner that the resident can understand. You can find all of these new requirements under the transfer discharge regulations in the revised federal nursing home regulations. Apart from the transfer discharge regulations, the closure rules are also located throughout the regulations, including in the administration section. During a closure, the administrator is required to submit to the state survey agency, the state long-term care ombudsman, residents of the facility, and the legal representatives of such residents or other responsible parties written notification of an impending facility closure. After the notice has been submitted, the administrator must also ensure that the facility does not admit any new residents. The interpretive guidance for 483.70L says the administrator's notice should be developed with input from the facility's medical director and other management staff. It must include a summary of key details from the closure plan for the safe and orderly transfer, discharge, and adequate relocation of all residents. For voluntary or state-mandated closures, the required written notification that is sent to residents, family members, and the long-term care ombudsman program must be sent no later than 60 days prior to the facility closure. In the case of an involuntary closure, in which the secretary terminates the facility's participation, the notification must be provided no later than the date the secretary deems appropriate. This administrator's notice must include the name, address, and telephone number of the state long-term care ombudsman. For residents with developmental disabilities, the mailing address and telephone number of the agency responsible for the protection and advocacy of developmentally disabled individuals. For residents with mental illness, the mailing address and telephone number of the agency responsible for the protection and advocacy of individuals with mental illness, and as noted in the interpretive guidance for 483.70L, contact information for the primary facility contacts responsible for the daily operation and management of the facility during the facility's closure process. In addition to written notification, the interpretive guidance states that the facility staff should discuss this information orally with residents, their families, and/or legal representatives in order to provide a better understanding of the situation and their rights. Of course, this notice must be provided in a language and manner that residents and other responsibilities and parties can understand. So this is also another fail-safe for the notice, and we're seeing a huge emphasis on the notice process here. Finally, the interpretive guidance mandates that the facility will not close until all residents are transferred in a safe and orderly manner to the most appropriate setting in terms of quality, services, and location as available and determined appropriate by the resident's interdisciplinary team after taking into consideration the resident's individual needs, choices, and interests. The guidance also requires that the residents complete medical information, including archived files, minimum data set discharge assessment, and all orders, recommendations, or guidelines from the resident's attending physician must be provided to the receiving facility or other provider at the time of the resident's discharge or relocation. With that, I will hand it off to Lori to discuss closure plans, policies, and procedures.
Okay, great, Alisha. So we will move to my screen next. So the closure process is obviously a really important one in terms of the impact that it has on the residents in the facility. And once a facility knows that it's closing, whether it be voluntary, it's choosing to close for whatever reason, or because it has been terminated from participation in Medicare or Medicaid, the facility or the administrator has the responsibility to do this, to actually develop a plan for the transfer and adequate relocation of residents and for assuring that the closure process is done in a smooth and meaningful way. And this is really important because our study showed that many closures that are happening are chaotic, that necessary information is not shared in a timely way with residents, with staff, with family members, that the process of moving residents to new care settings is inadequate. Residents are being moved without all of their belongings or without their medications. Their care plans or their charts aren't going with them. The receiving facilities don't have sufficient information about how to care for the individual. And what we're also seeing is that residents and families had been excluded from the decision-making process in terms of where they would go next, whether it be to a different nursing home or even what other types of care settings might be available or most appropriate for them. Some of the feedback that we had gotten during our study from residents, from ombudsmen, from staff, all indicated that in many places, the closure process is very chaotic, and the residents are having negative outcomes as a result. So the closure plan must be based on policies and procedures that each facility should already have in place in case of a closure or termination. They should not be developing policies and procedures when they're thinking about closing, but it's something that should already be occurring or in place in the facility. And then a closure plan would be based off of those policies and procedures. And the plan must include assurances that the residents will be transferred to the most appropriate facility or other setting in terms of quality, services, and location, and while also taking into account the needs, choice, and best interests of each resident. So it's important now that residents be included in the decision-making of the process, and that their needs and best interests and their choices are taken into account as new settings are looked at for where it will be that they will be relocated. The other thing is that the closure plan must be reviewed and approved by the state survey agency. That's another important feature. So it's an expectation that the closure plan would include information that's necessary to identify the steps that the facility will take for a safe and orderly closure, which, as you know, includes the transfer, discharge, or relocation of all residents. And that the plan would also list out the contact information for the individual responsible for ensuring the steps are successfully carried out. Some steps that need to be identified include, for example, assurances that no new residents will be admitted to the facility on or after the written notice of closure was sent to the survey agency. So once the facility has determined that it will close, or it has received notice from the state survey agency that it is being terminated from Medicare and Medicaid, it should not be accepting new residents into the facility. The closure plan should also identify the process and procedures for providing written notice of the impending closure in a timely way to the state survey agency, to the state ombudsman, to the residents and their legal representatives, and to other responsible parties. The CMS Guidelines lists, including as other responsible parties, that an administrator or a designee must also notify the medical director, the resident's primary physicians, the CMS regional office, and the state Medicaid agency. They're listed or referred to as responsible parties in the CMS Guidance. Facilities are also encouraged to notify employees, vendors, contractors, hospitals, other community partners or entities that either it does business with or provide services to the residents of that facility. That seems like a common sense approach to ensuring that there is continuation of appropriate care for the residents. The closure plan should also include the process for how the closing facility will identify available facilities or other settings. So again, they should be looking at quality services, desirable locations, and other factors that take into consideration the needs, the choices, and the best interests of each resident. We'll often see in a closure situation that groups of residents are being sent to, say, maybe a sister facility that's owned or operated by the same individual or company that owns the closing facility. And just by determining that these residents are going to go to the sister facility does not take into account individual needs and choices. That happens without regard for where the resident might want to move themselves. It doesn't take into account the quality of care in the other facility or how convenient it is for the residents, family, and friends to get to in order to visit them. So there should not just be this decision that's made that all residents from facility A that's closing should go to facility B that's owned by the same company. A closing facility must take into account the factors of the resident's choice, the best interest, what their needs are, which is also why it's really important to include the residents and their families or legal representatives in the process of determining the most appropriate location for that person. All facilities are required to have policies and procedures in place, as I mentioned earlier, that address the issue of closure or termination. And these policies and procedures will form the basis of a plan, a closure plan, should a facility end up having to close. So as the administrator incorporates the policies and procedures into the closure plan, he or she should be addressing a number of different issues. So first of all, they should be looking at the administrator's duties and responsibilities, which were mentioned earlier, submitting a closure plan for approval to the state agency, the notifications that are required to the state agency, to the ombudsman, to the residents and the family members, among others, and the assurances that no new residents will be admitted to the facility. But the plan should also address things such as who is going to be responsible for the daily operation and management of the facility during the closure process, and it should indicate who that person will be. The plan should also address what the roles and responsibilities are of the facility's owners, administrator, or their replacements, or if temporary managers or monitors are installed, it should include their contact information and what their roles and responsibilities are, so that there is clarity among who is responsible for what features and functions of the closure process and who it is that needs to be held accountable for those things. The policies and the plans will need to address how operations and management of the facility will continue during the closure process. That includes paying the salaries and expenses that are incurred of the staff that are still working in the facility, for any vendors and contractors to assure that supplies still remain coming to the facility, that there are still staff there that are able to provide the care for the residents. They also need to address the continuation of making sure that there are appropriate staff on hand to meet the needs of each resident, as is required currently under federal law. That doesn't change during a closure process. It becomes challenging, certainly, to maintain staff during a closure process, but a facility must have a plan in place for assuring how they will do that, and that needs to be part of the plan. The plan also needs to address the continuation of resources to meet the needs of each resident, including the provision of medications, making sure that they're on hand, that they are appropriately being monitored, services and supplies, treatments that are ordered by the residents, physicians or practitioners. All of those things need to be maintained during the closure process, and the plan needs to address how the facility will carry out all of those responsibilities so that the resident care does not decline during the closure process. As I mentioned, there are real issues with maintaining the levels of care and services during closures, particularly if it's due to termination by CMS due to poor care. Because once a facility announces its closing, staff are going to be worried. They'll be worried about their jobs. They'll be worrying about their own well-being, the impact on them and themselves and their families. So we know that it's challenging to keep staff on hand. We also know that when there's poor care, or if there are financial issues, there are challenges with vendors or contractors in terms of maintaining services. So it's really critical that those issues be addressed in the plan that is then reviewed and approved by the state survey agency to assure that the quality of care and services being provided to residents does not decline during the closure process. Other operational areas that must be addressed in the closure plan include ongoing accounting, maintenance, and reporting of resident personal funds. For those facilities that are managing residents' personal needs allowances or other funds, the accounting and reporting of that is required under federal law still needs to continue and be provided to the resident or their legal representative. The plan also needs to address how facility staff will ensure that all pertinent information about each resident is communicated to the receiving provider. Alisha mentioned earlier some of the information that needs to be included and provided to the new provider of the resident, which includes the complete medical record information, archived files, assessments, all of the physician orders and recommendations or guidelines from the resident attending physician. So the plan needs to address how that information will be provided and communicated to the receiving provider of the facility. And the plan also needs to address how the closing facility will properly take into account, safeguard, label, and transfer the residents' personal belongings with them to the new location to which they will be moving to. And that includes clothing, it includes medications, any furnishings. How is the facility going to assure that those things are labeled and go with the resident? And if there are challenges or missing items, what's the plan for looking for them, for making sure that they get reunited with the resident who has lost them, and making sure that they are tracked appropriately. You know, it's a scary, disconcerting, and stressful time being told that you have to move to a new facility or a new location. And we know that a number of residents experience transfer trauma and significant negative responses to relocations. As Dr. Rudder explained at the very beginning, we had a good presentation about that on the first webinar a couple of weeks ago, and you can listen to that recording on our website. But it's particularly challenging when residents and family members are not involved in the decision-making process and are not adequately prepared for the closing or the moving process. So another important requirement is to prepare and orient the residents of the closing facility to ensure a safe and orderly transfer and to reduce the negative impact. And one of the ways a facility can do that is by determining each resident's goals, preferences, and needs and planning for the services, location, and setting to which the individual will be moved, by having discussions with them or interviewing each resident in the facility and having conversations with the resident and their families or legal representatives about what it is that they are looking for in a new location and what exactly their needs and goals are in transferring to a new place. Because certainly we know that not every resident in a nursing home needs to transfer to another nursing home. Some might be looking at alternative settings, assisted living or community-based settings. And there may be reasons why people might look at different locations versus others, including where their families and friends live. So the facility should offer each resident in a manner and language as is understood, as Alisha mentioned earlier, the opportunity to obtain information regarding their community options, their setting, and location. As I mentioned, not all nursing homes will want to go to another nursing home. Many can transfer to a different location. And by providing them with the range of options available, the residents and their families can then choose a setting that makes sense for them. Also, importantly, the facility that's closing should make every reasonable effort to accommodate each resident's goals, preferences, and needs regarding their receipt of services based on location and also of setting. And again, it's important to note that it's each resident whose needs and preferences should be taken into account in these situations. So the CMS guidance states that the facility staff should make every possible effort to lessen transfer trauma for residents, and that includes making sure that the receiving provider is prepared and informed to care for the resident that is coming to them. So we've talked a little bit already about making sure that the resident's records and orders are given to the receiving provider, but it also might mean that the staff from the closing facility needs to communicate with the providers at the new facility and the staff that will now, from this point forward, be taking care of the resident. They should and certainly could be reviewing the residents' care routines, their needs and preferences with staff at the receiving facility that will be caring for the resident, and even assisting residents and their representatives with obtaining information that is required to make an informed decision about any facility relocation. Some of those things will really help by making the process easier for residents and families by engaging them in the process from the start. It will really likely make the transition easier for everyone involved. So the closure rules also provide for sanctions against administrators that fail to comply with the requirements of the rule, including failing to provide proper notifications, failing to provide or develop a plan that is approved by the state. You'll see on the slides what some of those sanctions are. They can include fines, they can include exclusion from participation in any federal healthcare program, or other sanctions that might be available through the state or through the federal enforcement process. But this is something that is certainly listed as a serious requirement by CMS, and one where the administrators have important responsibilities that need to be fulfilled. It's also important to note that the rules allow for continuation of payments to a nursing home by Medicare or Medicaid as appropriate until each resident is successfully relocated. And this is important because, as you know, there are some residents that are much more easily relocated than others. Some with special needs or with high care needs often have a more difficult time finding appropriate placement. And so this gives some good flexibility as the facility and any relocation teams are working with residents and families to find appropriate locations for them to move to, that the payment should continue until they are appropriately moved. And so it would be important for a closing facility to make sure that they are maintaining good and open communication with the state survey agency and the Medicaid agency, for example, to ensure that they're being kept abreast of relocation activities and challenges in identifying new and appropriate settings for residents, so that we can ensure that the residents are properly being cared for. So with that, we can turn to some questions and answers based on the provisions in the rules. So Alisha, can we look at whether or not there are any questions we can turn to?
Yes, so we have a few questions already in, so I'll just read one off and anyone on the panel is free to answer. One person has asked, are there any penalties for the violation of any of the closing policies?
So yes, potentially there are. I mean, certainly we saw on one of the slides that there are particular sanctions that are provided for administrators who don't follow the requirements that are set forward in terms of what their responsibilities are. But there are specific F tags that are tied to the different closure requirements in terms of having a plan in place, in terms of following the procedures. And so it would be important to make yourself very familiar with not only what the requirements are in the rules, but also in the guidance to surveyors, the interpretive guidelines, which lists out the F tags that facilities can be subjected to if they are not meeting the requirements. And also, they also discuss in the interpretive guidance what non-compliance looks like. So it's important to make yourself familiar with those, and we can make sure that links to those documents are on our website for those of you who want to check those out afterwards.
Great, thank you. Another advocate has asked, impending closure seems it would be a good time to reassess residents' ability to return to the community and potentially for staff to look at becoming DSWs. Are any states looking at these processes, possibly linking to MFP or ADRC?
This is Cynthia Rudder. If you take a look at our full report, and if you look at our full report in one of our best practice states, Ohio looks at nursing homes way before they're actually terminated. The regulatory people tell the ombudsman, who is the chair of their relocation team, which includes all the agencies of the state, that a nursing home may be terminated. At that point, the team gets into action, and their PASSAR people and their developmentally disabled people and their disability people go into that nursing home, even though it may not even close, because you know many nursing homes come back into compliance. But they purposely go in without mentioning a closure at all, and they start looking at residents at their Section Q referral question on the MDS, the question that a resident says, I want to speak about getting care in the community, and they start looking at PASSAR, and they start looking at residents maybe who could move into the community. And then if the nursing home actually is closing, the state already has these people on their list and begins to help them to move out into the community. And I urge you to take a look at our case studies of Ohio, and the contacts there, they're very happy to speak to you, everybody on that committee, if you need help in how that state is managing it. Thank you.
Yeah, that's a great point, Cynthia. Thanks for raising that. I think the question is a really good one, because it's true that not all residents want to or need to go to another nursing home, and they should be made aware of other options that are available to them. And one of the things that Alisha mentioned in her slides as well, some of the information that needs to be shared with any receiving provider is a discharge summary that a facility is supposed to create for each resident. And frankly, the discharge summary for all residents should be started upon admission. When the facility first receives the resident and they are assessing what their needs are, what their goals and objectives are for care, that's when they should be starting doing discharge planning for that person. And as Cynthia mentioned, it's included also under the Section Q, part of the MDS provisions. But as part of that process, that's where you can also start determining whether a resident's goals are to move back home, back into a different type of setting. And that will be really helpful in any relocation efforts in the event of a facility closure in terms of providing additional assistance to that resident.
Great, thank you. Another question. Does the regulations address temporary relocation of residents due to facility needing to do a major renovation project? So this means the facility would not be closing, but needs to have residents temporarily transferred elsewhere for 2 or 3 months.
Well, so it addresses relocation due to emergency situations, but it doesn't specifically talk about due to temporary relocation. So I think I'll have to go back and look at the procedures and think about that one a little bit more. But certainly, if residents are being relocated for any purpose, I could argue that the rules would still apply, and that they need to be offered options for where they're being relocated to.
This is Cynthia again. I'd also like to say that another one of our best practice states, Wisconsin, and Tom LeDuc, the state ombudsman, not the state ombudsman, sorry, he's the relocation specialist. He gets involved in a closure anytime 5 residents or more are moved. So it does encompass, his state laws encompass relocation. And he might be somebody that we could actually ask about how he relates to the federal rules. But in Wisconsin, at least, it is clearly in the state law that involves any more than 5 residents that are moved in any situation.
Great, thank you. So our next question, what if a facility goes from a nursing home long-term care facility to a short-term rehab facility? Can the facility keep their short-term residents? If Medicaid cuts happen, this may be the norm.
I'm not sure I understood that question, Alisha. Can the facility keep their short-term residents?
Yes, I guess so. So in case that the facility no longer provides care to long-term care residents, so all those long-term care residents would then be transferred or discharged. But can they keep the short-term residents?
So the issue comes down to how the facility is certified. And if it's certified for Medicare or Medicaid, however they classify themselves doesn't really matter. They are still subject to all of the requirements under Medicaid or Medicare rules. So they would still have to provide all of the notice requirements and provide all of the efforts necessary to assure that the resident is being transferred to an appropriate setting. And if they are looking to transfer from having long-term care residents to only short-term rehab, that's not an appropriate reason for discharge. And so they would still have to comply with all of the discharge requirements under the rules.
Thanks, Lori. Another question, does the DOH assist the facility with placing residents that the facility says they cannot place? I'm not sure what DOH stands for, but maybe
Department of Health.
Could you repeat that question, please, Alisha?
Does the DOH assist the facility with placing residents that the facility says they cannot place as the result of a closure?
This is Cynthia Rudder. I assume that the question relates to a state Department of Health, and it depends on the state Department of Health. In many states that do not have relocation teams at all, and that's one of our major recommendations, that every state should have a team that involves all the state agencies and the state ombudsman. The state health department may in fact not be interested at all in helping. So it depends on your state and whether your agencies work together to help make that a reality. One of our recommendations for states is that if facility refuses to take a resident because they say they can't care for them, we urge states to require some documentation for that point, rather than permitting the facility to discriminate on dementia residents or residents that may have some difficulties. So we're urging the state regulatory authority to take a stand really and force nursing homes to really show why they can't care for somebody. Another best practice state, Ohio, again, I believe, the state ombudsman looked at all records of residents who were having a hard time finding a placement that they wanted to go to make sure that the records were accurate, so that a facility who didn't want to take a resident because they were demented or they had some problems that may cause them issues, the state ombudsman want to make sure that the records were up to date. Maybe the symptoms were no longer there. They also would urge the facility to do an interview with that resident. But in most states, it's the state ombudsman and the local ombudsman who do work at that. But I urge you to try to work with your state to form a team where everybody works together so that the state does help and assist you.
Okay, great. Another question, in the slide addressing 483.15C3, the state LTC ombudsman will be notified of the closure. As an ombudsman myself, why is the program director at the local elder services not noticed directly so we can be immediately on hand?
So ombudsman programs across the country are organized and set up in different ways. And so this addresses the fact that the ombudsman program, the Office of the State Ombudsman, is to be notified, and then each state ombudsman program actually is currently setting up its process and policies for how to assure that the ombudsman in the area in which the facility is closing gets the information and is able to provide whatever response to the facility is necessary.
But again, if you have a state relocation team that works well, like Ohio, like Wisconsin, like Illinois, like Connecticut, and a number of the other ones we mentioned in our study, the state ombudsman would know about it way early, because the whole team is notified, not just the regulatory people. So I urge you to consider how you can make that happen in your own state. The other issue is that we believe that state ombudsmen should have a right to help form the closure plan. That it should not only have to be approved by the regulatory part of your state, but the ombudsman as well. And in some states, that's already happening again.
Okay, great. There are a couple more questions, so I'll just get to them. One of them is, are there any restrictions about what type of containers must be used in the move?
Not in the rules or the guidance, there aren't, but certainly that's something that can be looked at as part of the planning process. How do you make sure that not only is the resident being treated with dignity and respect, but also that their belongings are being appropriately cared for and packed as part of the moving process? So it is not a good feeling to have all of your belongings dumped into a trash bag and just piled on your bed or your chair or whatever it is as you're being moved. So I'm thinking about what that will look like in terms of how the residents' belongings will be moved and what form the packing will go into should be part of the process of planning for a closure that's orderly, that's safe, and that provides for dignity and respect for the residents.
Thanks, Lori. I would also like to add that I know in our report we examined a best practice in Rhode Island, and they actually use dissolvable laundry bags for the clothes so that the laundry bags don't transport any maybe bed bugs or any situation like that, so that once the residents' clothes are all unpacked, they can just dissolve the laundry while they do the laundry. So that's one container I've heard about being used to move in a closure.
Also, some states use CMP money to actually purchase cardboard boxes.
Okay, great. And one last question. How do you enforce non-compliance sanctions when the nursing home is already going out of business?
So that's a responsibility, obviously, of the licensing agency in terms of taking enforcement action against the owners, operators of the facility that's closing. There are more than just fines that can be imposed, and there's a full range of remedies that they should be looking at in order to enforce the requirements and to assure that the residents are being appropriately cared for even during a closing process.
Right. I mean, it comes, the state really is willing to enforce its rules. If somebody is closing down but still wants to keep a license in that state, then his license could be in jeopardy. He can be sued individually It depends again on what the state really wants to do and how strong they are in backing their rules and regulations, which we know is a problem. But there are ways can do it. And again, our report talks to that. That was a question that was asked of people, and there were many ideas that were given again in the report. It is a major problem. If somebody is getting out of the business entirely, what can you hold against him? Well, you can still go after him for money.
Mm-hmm. Absolutely. Alisha, are there any other questions?
Yes, we had a couple questions just come in the last minute or so. So
okay,
I think we
can probably do maybe one more. Mm-hmm.
Sure. How does PASAR OBRA play a role in closures?
Well, certainly. Go ahead, Cynthia. So certainly, PASAR is not specifically mentioned as part of the closure requirements, but as residents are being evaluated and discussion is taking place with them and their legal representatives and looking for appropriate placement for them as part of a closure, that certainly should be taken into all of their needs, whether it be physical needs, psychosocial needs, mental health needs. All of those needs need to be taken into account in looking for appropriate placement. Sorry, Cynthia, go ahead.
I'm sorry, I may be cutting in and out for some reason. I was just going to say that in some states they look to see whether the PASAR is accurate in a closing facility, to see whether the individual can live in the community, number one, or if not, whether they're getting the specialized services that they do need. In one of the states we are working with now, the PASAR division of the state for the first time is being involved in the relocation team, and he in fact is very concerned to make sure that the residents who need it are getting the specialized services they need in their new facility. So it becomes a part and parcel, as you said, Lori, of meeting the needs of the residents.
Okay, thank you. I think we can go ahead and close out. So
great. Well, thank you. Sure. Thanks so much, Alisha, for facilitating the questions and for your presentation today. And also, Cynthia, thank you for your presentation and your question responses today. We are finding this topic to be one of great interest to all of us. And as Cynthia mentioned earlier, we are working with a couple of states right now, providing some direct technical assistance to them as they look at improving the processes and procedures for closure in their states. We are interested in working with other states as well. So if this is something that you might be interested in your state, please reach out to me and let me know, and we can have some conversation about what that might look like. As Alisha mentioned at the beginning, this webinar has been recorded. This and the first webinar that we did a couple of weeks ago will be listed on our website, along with a number of materials around the closure process, including our report, information about the best practice states, information about the rules and the guidance that we talked about today will all be accessible on the Consumer Voice website, which is at www.theconsumervoice.org. So thanks so much for joining us this afternoon. We will be having a third webinar in this series in the spring of 2018. So please watch your emails for notification of that so that you can register. Thanks so much and have a good rest of the day.
Thank you.